Thanks, doctor, for meeting with me today. I wanted to let you know about a client that I've been working with.
Sure.
This is her first time in treatment. She's 42.
Okay.
She has been struggling with anxiety and depression issues for some time now. She started with a prescription benzo that she was taking regularly, but then she started abusing the benzos because, according to her, they weren't strong enough. So in addition to abusing the benzos, she started drinking alcohol on top of that. So now that she's in treatment, she's had some struggle with her anxiety and a couple of panic attacks since she's been here. And so I'm thinking that because her underlying issue is anxiety, that I would refer her to you to see what we can do to address her anxiety issues while she's here in treatment.
Okay. How was she referred to us?
She came from the health department. Her local health department referred her. She went there for an assessment and then came to us from there.
Okay. And so she's here with us, ready to make some changes?
Yes, she wants to taper off of the benzos, and she also, of course, wants to stop drinking. So that she's here in detox for that purpose, but she's still having some underlying anxiety issues because she's not taking the benzos like she used to.
Okay. So her motivations for making changes is not pretty good.
Right.
Pretty good. And about how long do we know has she been taking the medication?
She's been taking benzos for about 5 years now.
And they were originally prescribed?
She was originally prescribed Klonopin twice a day, but then she started abusing Xanax, and she was getting that off of the street.
Okay. And have you spoken with her about wanting to refer her to me?
She's interested in seeing a psychiatrist to address her underlying anxiety issues, and she's interested in some alternative medications that may help to address her anxiety that are not benzos.
Okay. Oftentimes with anxiety there's a sort of a co-occurring depression. Does she have any history of depressive
She
symptoms?
does. Yes. And she had been treated for that in the past, but not recently. She hasn't been taking any antidepressant medications recently.
Okay. Well, it sounds like a good candidate for us. In terms of the medication, Buspar is available, which is an anti-anxiety medication, as you probably know, that is non-addictive. Doesn't often work as well as the benzodiazepines, but it's certainly worth a try. And if she has some depressive symptoms, I can talk with her about those to see if one of the SSRI antidepressants might also be something to consider, because it can target both the depression and the anxiety, or some combination of the two. So, do we know what? Do we know? Does she have other ways of calming herself, relaxing herself?
Well, she has been active in some of the groups, and we've done some stress reduction techniques with her, and she seems receptive to that.
Great.
And so I thought that in addition to those techniques, we could maybe get her on some medications that would help calm some of the symptoms down, so that she could even be more receptive in treatment and learning some more coping skills.
Absolutely, and I will tell her, and you can certainly reinforce it, that doing both, doing some behavioral strategies in addition to, or in conjunction with the medications, usually has the best outcome. So sounds like a good client for us to have and to work with.
Good. I'll set her up then to meet with you sometime this week, and I'll let her know that we spoke.
Great.
And that she's a good candidate for potentially getting some medications on board.
Super.
All right.
Great.
Thanks. I appreciate
Thanks for
your time.
coming in.
Yeah.